Good morning, humanity. It's February 17th, 2020, and it is that time of the week because it's Mondays with Bev and Paul. And hi, everybody, my name's Paul.
Good morning. This is Bev.
And hi, Bev.
Oh, hi, Paul. How are you?
I'm well now that it's warming up here in Tucson, Arizona.
Oh, whatever.
Whatever. It's still cold up
It's
there, huh?
we have our moments. Yeah.
Hey everybody, how are you today? And as you can see on the little picture here, we're going to talk about is biotouch part of integrative medicine? And I got really inspired this weekend. I went to a group called the Academy of Integrative Health and Medicine. It's a fellowship, a group of doctors, professional people, alternative complementary therapists around the country. And then what they've created are different chapters in different cities. And there's a chapter here for the Tucson, Phoenix area. So it was an inspiring meeting that I met other people, especially a lot of professional doctors, using
Oh,
integrative approaches to biotouch. And a lot was shared about a lot of the work being done in integrative healthcare. So we're set, and we've been talking about this for a long time, haven't we?
yeah. Yeah, and it's time that we really contribute to all of that, I think.
Okay, so what we want to let you know too is if you're out there listening to us, you can look into some of the research being done with other integrative approaches. You can go to look up NIH and then CAM, two different words. It's the Integrate National Institute of Health, and they have a very specific section on complementary and alternative medicine. So if you just look up NIH and CAM, it'll take you right to that website. And oh my God, they are loaded with data and research and ideas for different diseases, different programs that you do. And specifically, we want to talk about the research and the data that's been done with BioTouch and how some doctors out in the community are talking about BioTouch.
Definitely.
That's a good one. So, what we
Yeah.
wanted to share first before we start our little dialogue is we had on here Dr. Richard Abalay, longtime practitioner in BioTouch, and we took out a little section of his on how he thought BioTouch would work as an integrative approach to your healthcare. So let's show this, and then we'll come back and talk to you about it.
Do you have a vision of how you want to use BioTouch?
Well, I think I think one of the so where I'm moving into in my career right now is I've been very moved in my own personal work, my own journey, and looking at what my current patient population is presenting and teaching me. Um, I've come to realize that probably greater than anything affecting health is the bioenergetics that start with our thoughts, because we know our thoughts are
Hmm.
energy, and also the energy field that we are, because in quantum physics we know that's what we are in the end. We're everything we see as solid is really not solid. It's just energy in a state of tremendous vibration that makes it
Right.
appear solid. So with that in mind, I think BioTouch is an incredible resource. And I'll put it just simply like this, because I'm sure the audience here knows what BioTouch can do, and maybe some have experienced that already. But simply put, what I like about BioTouch, as I was thinking about this question prior to this, is it removes the confounding variable of thought in the healing process.
That's a
Wow.
good one.
And the reason it does that is you literally just touch. Because other energy modalities talk a lot about the practitioner has to come in with focus and intention and this and that, and the person receiving has to be in a state of mind of this and that. And I think it makes it very complex, and it starts to put the conscious mind in play, which then can make a disaster of it all, in the end. Whereas with BioTouch, there isn't that. With BioTouch, it's just touch, and the body, that innate wisdom that is there, then knows how to take that energetic signal and do what it's got to do, regardless of whether you believe it or not. It just does. And that to me is the power of BioTouch.
There you go, Bev. You like that one.
Yeah, that was a great show. I loved having Dr. Richard with us that day.
Right. So, I mean, it's amazing when he talks about BioTouch removes the confounding variable of thought.
That little monkey mind we talk about, right?
Right. And when I was listening to a lot of the research on the CAM website, and this woman was presenting all the different researches in acupuncture and yoga, and a lot of these techniques, you had to go somewhere, you had to do something, and it was sort of out of the realm of possibility for a lot of people. But with BioTouch, you just do it, and it can be done at home. It can be done in front of the TV set. In fact, let's read a part of our manual. You have there the preface, right?
I do.
Gives it. Let's read that little part in there that we can build on.
Yeah, just basically one little sentence. It's in our preface in our manual, and it says, there is no attempt in the following pages to explain why these procedures work. The goal is only to teach an individual how to touch certain points, which will help to facilitate the healing process rather than to do something. And, I mean, a lot of times people do, what they do is they believe they have to center, come into mindfulness, do all these outward things, clear the space, all that kind of stuff, which is wonderful. But what's even more wonderful is with BioTouch, just touch.
I know I always share that little thing of when I went into Norman's house, there was just smoke, and the soaps were playing on the TV, and coffee was pouring, and like I always say, there was no whale music, tingling cymbals, or incense burning.
Incense.
And again, I think what we're saying is anything is fine, whatever you need for healing, but it's nice to get back to the basics, that all you need are these two fingers, and lightly touch another human being. This is not a self-healing technique in one sense. It's about reaching out and touching another human being, and then using it and letting it happen, not trying to direct the energy or move the energy, manipulate the energy, or think that we know what that particular body needs. I'm working with a person now, and it's sort of like the body's got this other thing that it's going through. Sometimes I feel like, God, BioTouch isn't doing what it's supposed to, but I know, and I can see it in this woman's eyes. She's relaxing while her body's going through all this stuff. And it's not about me trying to manipulate or focus on where I think the body needs to be.
Or be the healer.
Right.
Or that's another important component of BioTouch, is it removes us from all those titles and responsibilities of being this and not doing enough, and all those kinds of little ego things that begin to happen.
Right.
Yeah.
And we have that. So we sent out this email to people, and we got this email back from another doctor that you're working with in Dubai.
I am.
And I sort of just want to read a little of what he said, and then Bev will share his testimonial, because we have this 21-day program. Just do the greeting for 21 days. And then for another 21 days, do the greeting in the headset. You're talking about a 30-second part of your day And Zalgul says, what a beautiful feature, experiences and feelings. Since I started with you every day, my love increases for BioTouch healing, and I started applying sets of points to a group of children. And he gave you that testimonial about what happened when he was doing BioTouch, yes?
Yes, one of the children that he's working with, she was born with cerebral palsy. She's 6 years old, and he has been, well, the first 30 days that he worked with her, he did BioTouch with her 5 days in a row for 30 days. And at the end of that, he actually had on his phone captured her taking her first steps to her mom. And, you know, I mean, that was just incredible. He was so excited. He loves BioTouch. He's this
And
amazing doctor there, a doctor without drugs, he calls
that's what he
himself.
calls himself?
Yeah,
Really?
he's a doctor without drugs.
So there you go, folks. It's being applied, Dr. Avile, Dr. Zabul, around the world. It's an integrative approach to your medical protocols, and it doesn't negate doing your medical protocols. It doesn't negate the operations. It doesn't negate the medications. It can only help. And what we did is we had some research. What I learned from this, going to this group of people, and they were showing the research, the published data. God, we have tons of data that was clinically done. You know, not just
Yeah.
questionnaires, but we did Dr. Stevenson, who actually did saliva testing, blood spot testing, this huge questionnaire. And we have the research data here also to share with you. And what we have, we did some research with Dr. Um, Schwartz at the University of Arizona, where that's a huge school of integrative medicine. And we have pre and post sessions of pain. And as you can see, the pre-session of pains are the solid line, and the post-session, well below those, is the dotted line. And Amity was a drug rehab community. We had a center in California, we had a center in Hawaii, and we had a center in Arizona. You can see we had, well, 900 participants. And you can see the huge drop in the stress of the drug rehab community. Those people almost felt like they were passing out. And it was the same drop in the high school kids when we did that. The high school kids actually said, "Oh my God, I haven't gone this high. It's the best drug I've ever taken." So we used to tell them it's the drug that won't get you in trouble.
Right.
So the thing we want people to know that I learned also at this meeting this weekend, when you have that P factor that's less than 0.0001, that means because you had so many participants, it's not happenstance that you got those results. And another one we did was for pain, pre and post session of pain. And again, P factor less than 0.0001 in people having a reduction of pain pre and post session. It doesn't get much better than that. And even feeling cared for, we talked a lot about that. How do people feel more cared for? And here is what we found with that. That on the skin, people felt more cared for than going through the clothes and non-contact kinds of healing techniques. Overall, it's just amazing that we have the research to actually document BioTouch can be a part of your integrative medicine approach, and you can notice results.
Yep, it's time.
It's time. And so what we really love showing people, and we love bringing this up all the time, is the stress cycle that Dr. Stevenson found when she did the research. And let me just bring that up. So as you can see here, we have all these stressors in our life. And, it was interesting learning about that at this weekend, too. These are the things that you can't almost help. Some of them, like tobacco you can, alcohol use, but relationships, interactions with our community, the environment, diet, you can control a little bit, prescriptions, even non-prescription medications. Genes as a big part of our stressors. We actually carry stressors uh, in our DNA from our parents and our grandparents. And we have psychological stress, economic stresses, lifestyle stresses, childhood trauma, physical abuse, socioeconomic status. All those things create what Dr. Stevenson called chronic stress. And those chronic stress uh, on our body creates a cortisol dysregulation, which there are some practitioners in the health field who they won't even work with you until they check your cortisol levels.
Right.
And immune dysregulation, we're finding children are being born immune deficient. And all of those things create in the long term dementia, cardiovascular disease, infection, benign and malignant tumors, mood disorders, and obesity. And what Dr. Stevenson found with intensive research data is when you put BioTouch into the chronic stress cycle, you actually, one, improve the circadian pattern of cortisol release, which improves the quality of your life, and increases interleukin 12, which improves your immune system function and increases the activity of genes that fight infection and cancer and promote healthy aging. You know, if that's all we do is promote healthy aging, that's hard to get across to a 20, 30-year-old because, you know,
Right.
when we're that age, we're not going to get old.
All right. I'm not aging.
But, you know, just doing that in our stress cycle, we are creating a body that can cope with the stressors of our life. And
Yeah, I mean, you know, at the end of that whole research, Dr. Stevenson surmised that with just one session a week of BioTouch will help, you know, with that maintenance program, preventative program, helping with whatever, you know, you're currently working with. It increases the quality of your life
yes,
once a week.
that's nothing, folks.
Come
And,
on.
you know, come on. Just touch. Take the two fingers. Go to
just do it.
Go to justtouch.com. You can download for free the first 10 pages of the manual, which will give you the greeting. We can plug you into the 21-day program, which will remind you. Just add 30 seconds into your day and make BioTouch part of your integrative medical approach. You know, talk about it with your doctors. Ask them if it's okay if you don't trust us. I think what you're seeing is the dialogue is finally opening up where doctors, medical professionals are all bringing in a holistic approach of all these different techniques. And our only goal is to get you BioTouch. Whatever else you add, man, that's just icing on the cake because BioTouch can be a great foundation for your integrative approach. And then build onto that. Since BioTouch really is, you're not giving people anything, you're not projecting anything, they're not taking anything. It's just touch. And let's teach them something, you know. So we always want to teach you a little set of points. And so here we go. We're just going to teach you the neck set. Real simple, but very relaxing.
The neck set is used for addressing most headaches, neck pains, and soreness of the upper back. These points are performed in matching fire on the large muscles that run along the back of the neck. Points 1 and 1 are halfway down the neck on the side of the large muscles. Points 2 and 2 are at the top of the neck on the side of the large muscles at the base of the skull. Points 3 and 3 are at the bottom of the neck on the side of the large muscles. As with any set, you may repeat the points as many times as you like. These points may be touched in any order, such as touching points 2, then points 1, and finally points 3.
It does not get any better than showing that neck set with two young people. I mean, you could do this in this classroom. You know, your classmate gets a headache. Instead of, you know, running for a Tylenol or to the nurse, you know, the teachers can start incorporating this with the kids. Just touch, you know, allergies, you know, those kinds. Oh, my God.
I know.
It's inspiring to me.
It is.
It is?
Well, it's waiting.
It's waiting
for everybody.
It is. And, we have a class coming up that we hope that you'll want to participate in. It's our bronchitis and pneumonia. Everybody's freaking out about that right now. And Dr. Willingmeyer from the VA hospital here in Tucson will be here February 27th. We'll also be live streaming that. It'll be at 6 p.m. Tucson time. If you're here in Tucson, come join us. And if you just want to join us on live stream, I think it's going to be a very informative evening. Yeah. So, Bev, should people do BioTouch?
Integrated, of course.
Integrated, yes. Integrate. So we encourage you all, go to justtouch.com, contact us, let us know how we can help you integrate BioTouch into your medical program for your health care, for your well-being, for you and your family. And if you're in the Oregon area, get ready, because Bev's got some classes coming up and some workshops coming up, and she is going to be on a roll here as soon as the weather gets a little better. We're going to do it. Yeah, yep. Do it. Just do it. Just
do it. Just touch.
Hey, so we're glad you all joined us. Good to see you, Bev.
Good to see you too, Paul. Thank you.
Yeah, and we'll see you all next week.
If pain has got you down and you live in town, take a trip down to Pima Street. The people down there are people who care. They will get you back on your feet. Put love into action. Put love into action. If you ever want to have any real satisfaction, choose love while you still can. Don't even try to understand. A healing grace in your own hands. Put love into action.